Welcome to another edition of Health Watch. I am your host, Franka Potter. The Medical Services Unit at the British Virgin Islands Health Services Authority has embarked on another specialty clinic, a radiation oncology clinic. Men and persons dealing with cancer or prostate cancer are encouraged to partake in this clinic. My guest today is Dr. McGowan. He has over 25 years of experience in radiation oncology, and he will be seeing patients monthly right here at our outpatient specialty clinic. We have to take a quick commercial break. Thank you for joining, and we'll be right back. The British Virgin Islands Health Services Authority is delighted to present the new People's Hospital to the residents and visitors of the Virgin Islands and beyond. The government of the Virgin Islands dedicated this new state-of-the-art facility in December of 2014, and a full transition of patients and services were completed to usher the Virgin Islands and the region into improved health care for 2015.
We are the BVI HSA.
We are the BVI HSA.
We are the Human Resources Department.
We are the BVI HSA.
The new People's Hospital is one of national pride and hard work, but above all, it represents a commitment for optimum health care and well-being. We are staffed with certified doctors, nurses, pharmacists, lab technicians, and other employees working together to ensure that our patients' experience is one of excellence. We are one BVI HSA, and People's Hospital is for you, for me, for our families, for our friends and neighbors in and around the Virgin Islands. At the British Virgin Islands Health Services Authority, only excellence counts.
The Facilities Management Unit would like to remind all visitors at People's Hospital to watch your steps when entering or exiting our elevators.
Welcome back to Health Watch. Again, I am your host, Franka Potter, and joining me is Dr. Thomas McGowan. He's a radiation oncologist and will be providing clinical services here to the residents and visitors to the Virgin Islands. Welcome, Dr. McGowan.
Thank you very much.
It's a pleasure to have you here.
It's a pleasure to be here.
Unfortunately, cancer has been on the rise here in the Virgin Islands, so this clinic is an extraordinary service now available to the community. Can you tell us a little bit about yourself before we get into the discussion about the new clinic?
Sure. So I moved from Canada to the Bahamas 2 years ago, and there's a cancer center in the Bahamas that I run, and then we opened a cancer center in Antigua a year ago. So I've been splitting my time between the two. Before that, I was in Canada. I ran a department in Mississauga for 10 years that we treated 3,500 patients a year.
Wow.
Prior to that, I was head of radiation oncology for the province of Ontario and executive vice president at Cancer Care Ontario, the provincial cancer agency. So I have a long history of doing a lot of clinical service as well as administration and structuring departments. As far as my clinical expertise, I'm still a full practicing radiation oncologist. I've treated a lot of prostate cancer. In fact, that's probably the area where I've got the biggest area of expertise and experience with prostate cancer.
Wow. Will you be dealing with prostate cancer here in the Virgin Islands?
Yes, in fact, that's a very important thing because that's what I'm starting with first. Prostate cancer is a very important disease, and it's important that it get treated properly because if men get put onto drugs that block their hormones, it can cause a lot of bad side effects for them. And if they don't need to be on it, not only is it cause side effects for the men, it also is expensive for the government. And so with the experience I have treating prostate cancer, as I was speaking to the physicians here, I think the best thing was for me just to go through all of the patients that are currently on hormone therapy, reevaluate them and make a decision about what we need to do to optimize their care and to minimize the side effects from drugs. And there are many people that need to be on it, but for those that don't, we can take them off.
So you're going to primarily focus on prostate cancer here in the Virgin Islands. Wow. How did you get affiliated with the authority?
So it started the way a lot of these start is, physician to physician contact. And so we've been running the cancer center in Antigua for about a year now. And Dr. Felix had a patient that he needed to have treated with radiation. And we know some of the people that he knows, so he called me, we spoke, and then I realized, we could work together very well. So I was invited to give a talk. So I gave a talk at the continuing medical education event that was held in the fall, presented to a lot of the physicians here in the country, started talking with the staff here, the administration, and the idea came up that it would be a good service for the people of the British Virgin Islands for me to come and start this. And in addition, it's very important that patients don't have to leave to see an oncologist. It's a lot of, it's 2-3 days for someone for a half-hour visit. It's a lot easier for me to come
and
to see 10 patients than it is for 10 patients to fly someplace else to see somebody. So, so all of those, it made sense.
So you're going to have you're beginning monthly clinics here at People's Hospital, the outpatient clinic, right?
Well, it'll be minimum monthly.
Okay.
We started actually this month in June. So I've been here every week since the 1st of June, so the 1st, the 8th, and then the 15th. And there's a large volume of patients that really need an assessment. So I'm going to go through and see a lot of those patients. And once I'm through all of those patients, what we refer to as prevalence, it doesn't matter what the word is, but they're patients that already have cancer that need to be reevaluated. And then I'll start the clinic depending on the number of patients that are referred. Minimum of once a month, could be twice a month.
Wow.
It's an easy flight here from Antigua. Liad comes here directly, and it's an easy flight.
It's an easier flight.
Yeah, I don't know.
Just for numbers, what are we looking at locally in terms of how many patients that are already earmarked?
Well, there are 60 patients at a minimum that need to be evaluated, patients with prostate cancer or who likely have prostate cancer are going to be reevaluated through this clinic. And then as far as the number of patients that need to be seen, it's hard to know because one of the things you need to have is you need to have a cancer registry. And in the Caribbean in general, the cancer registries are not robust, and so we don't have good data. We do know there's a high incidence of prostate cancer in the region, high incidence of breast cancer, and a high incidence of cervix cancer. So there's going to be a lot of those patients need to be seen, and then all of the other cancers need to be seen as well. So I don't know how many it's going to be from the region, but there's certainly 60 patients that need to be seen now.
Wow, wow. As you start with the assessment process, what are the treatment options available or could be available here through People's Hospital?
So when you have someone treated with cancer, the most important thing is to make the right decision. And then once you make the right decision, then you have to go through the steps to say, how do we carry that out? So what my focus is to make sure that we're making the right decision for the patients, and then decide what needs to happen with them. So there's patients that are on this hormone therapy that's blocking the male hormone. Some of them need to be stopped. Some of them need to just continue. Some patients need to have a biopsy again to decide what to do. Some of the patients are going to need curative treatment, which can be, depending on the patient's health, the extent that the disease, could be surgery or it could be radiotherapy. And the radiotherapy we obviously can do in Antigua. As far as the surgery, we need to have a urologist that could then do the surgery. And so those major interventions would be done off-island. The management of the hormone therapy can be done here. I mean, we are giving the patients this drug already. It's just a matter of making sure they either need to be on it or don't need to be on it. We can start or stop. And the biopsies are done here as well. So all of that management and diagnostic steps and decision-making are done here, which really keeps the patients close to home. And then if they need definitive therapy, they have to go off-island. So to Antigua for radiotherapy, or we'll have to, depending on the patient, depending on the surgeon, depending on where they go for surgery.
Wow. With over 25 years experience in radiation oncology, I know that there's no exact reason or cause of cancer. There's no full-blown treatment in terms of curing 100%, right? But do you think there are some lifestyle choices persons can make, or the increase in cases of cancer in the Caribbean, or in particular in the Virgin Islands? As you stated earlier, the data is quite flawed or not there. So is it possible the level of cancer patients existed, but we just didn't know how many and at what stage? Or you understand what I'm trying to ask? Or is it new cases, the increase are really within the last 10 years, for example, new cases, or it's just that the data is now there?
So I believe this rate of cancer has been what's been present for a long time. There's a better awareness. Cancer was much more of a taboo disease, and there's in some areas it's still considered a taboo disease, so people don't talk about it. You know, people have aunts or uncles or grandparents that died of something,
And no one
old
knew.
age, they say, but you know, a lot of them would have had cancer. Or people have it, they'll be treated successfully, and they don't talk about it. So there's a very high incidence of the breast cancer gene in general in the English-speaking Caribbean, which puts women at a much higher risk of developing breast cancer.
Okay.
So if someone has a family history, they need to make sure they get mammograms early. If someone has a relative, a sister, an aunt that had breast cancer, whatever the youngest age is,
Wow.
they should start doing their mammograms 10 years earlier. So if someone has a relative that had breast cancer at age 35, they should really get a mammogram in their late 20s.
Okay.
So there's that gene. Prostate cancer is also similarly, there's a genetic risk to it. And I think men really do not like getting
Prostate screening.
prostate screening.
Yeah.
I mean, they just don't. It's hard to get them to do it. And so it's diagnosed a bit later. In fact, that's one of the biggest issues is more that we have late diagnosis. The cancer is diagnosed later. So instead of it being an early stage curative cancer, it's a late stage cancer, which then causes tremendous side effects and tremendous problems for patients. And they need much more aggressive treatment than they had have got it earlier. One of the ones that does have a real significant increase incidence here, and I'm speaking generally in the English-speaking Caribbean,
of course.
is cervix cancer.
Okay.
Cervix cancer really is a disease that should not be killing people anymore. There's a couple of reasons. One, pap smears can detect it very early. And if you detect a very, very early, what we call a pre-malignant lesion, something that's, it's not cancer, but it's just about to become cancerous, a minor treatment can get rid of it.
Wow.
If you wait until a woman's got symptoms, it's often well past that. The other thing is that the HPV, or the human papillomavirus, we know that is a cause of cervix cancer. And there's a vaccine that
Can prevent it.
prevent it. And so girls need to take it. Young women need to take this vaccine. That plus pap smears can really eliminate cervix cancer. Cervix cancer is a disease that we can get rid of by doing the things to stop it.
Yeah, preventative measures.
Prostate cancer, breast cancer, we can improve cure rates by diagnosing people early, making sure people know that if it's diagnosed early, it's not a death sentence by any means at all. Cure rates are very, very high. And as far as lifestyle goes, we know what we need to do, right? I mean,
Tell them again.
everybody knows that. Don't eat fatty food, sleep well, don't drink too much.
Some
don't,
exercise.
Don't smoke, exercise. And everyone knows that, but fatty food tastes good.
Yeah.
So people eat it,
What
People
about the
don't
processed foods, canned foods, things like that?
It's all the same, the better, the fresher the food, the less processed it is, small amounts of meat. All of these things, we know what we need to do. You don't need a doctor to say eat healthy, sleep well, exercise.
Yeah.
You just need to have a little bit of, strength to be able to do it. And I'm guilty of it too. I mean,
Yeah,
it's
of course.
difficult. It's difficult to do, but we know that. What's really interesting here though, and this is something I hadn't realized until I got here, the rate of smoking cigarettes is very low. So lung cancer, which is a deadly, deadly disease and something that we treat a lot of in Toronto, I see it very rarely here.
Yeah.
And when I was in Canada and people said, what should you do? I would say the first three things is don't smoke, don't smoke, don't smoke. Those are the three most important things out of 10. It's so important. Already people here don't smoke. So now we're looking at the next level of things to do. So, I mean, we start here well ahead of North America as far as cancer prevention in that way goes. But fatty foods, exercise, low stress. Well, we have low stress, but
No, we have a lot of stress here.
I don't know.
You haven't gotten it yet.
I haven't gotten it yet.
Yeah, that's amazing. That's amazing. I know when we started 2016, the medical services unit, that was one of the concerns.
Yes.
Like cancer across the board was increasingly prevalent here. So we're glad to have you here.
Thank
Welcome
you.
aboard.
It's a pleasure being here.
Welcome
I've
aboard.
really enjoyed it.
Wow. So right now you're going to be here every week.
I've been here every week the first 3 weeks.
Okay.
And we're looking at setting up the rest of the clinics. We have to identify the patients need to come. We need to make sure it's schedules with nursing staff, other physicians.
Wow.
But I'm seeing quite a few patients, and then we're going through the list of patients that are already being seen here.
Wow.
And patients that are on long-term hormone therapy that may not be seen at the hospital, they are
Come
more than
in.
welcome to come in and book in to see me.
Wow.
Yes.
It's a pleasure having a chat with
Thank
you.
you very
Thank
much.
you.
It's been my pleasure too.
Definitely have to come back on.
Thank you.
Yeah.
Appreciate it.
We're going to take a quick break. I'm going to give you the number in case you or a family member, a friend, or someone you know may be suffering with any form of cancer here in the Virgin Islands. How to get in touch and have a clinic with Dr. McGowan.
Yes.
McGowan while he's here. We're going to take a quick break. We'll be right back.
I'm a mother.
I'm a team player.
We are BVI HSA nurses.
And we are proud of what we do.
Hi, I am Marina Bidu, the Expanded Program on Immunizations Manager, and I'm coming to you today from the Toy Box. The Expanded Program on Immunization, Ministry of Health and the British Virgin Islands Health Services Authority reminds parents and guardians to ensure that your child or children's immunization status is updated. You can visit any of the public health centers for more information. Remember, immunizations are important and they can save lives.
This has been another edition of Health Watch. I want to thank my guest, Dr. McGowan. He's our new radiation oncologist, and he will be holding monthly clinics right here at the British Virgin Islands Health Services Authority. If you are suffering with cancer or know someone that may be suffering with cancer, we want to encourage you to give us a call at 852-7500. You can also visit us online at www.bvihsa.vg, and you can also watch this program in its entirety on our YouTube channel, BVI HSA. I am Franka Potter. Thank you for joining.